guys, welcome back to my brown physio. I'm Dr. Neha Singh, and today in this video we're gonna study about clavicle fracture. So the clavicle fracture is the most commonly broken bone in the body. It has three types. First, medial or proximal, which is least commonest. It consists of 5% of all clavicle fracture. Then medial 1/3, which is most commonest of all clavicle fracture, consisting of 80% of all. Then third, lateral or distal clavicle fracture, which consists of 15%. Medial 1/3 clavicle fracture is most commonest because this is the thinnest part of the bone. Now let's see the mechanism of action. Fall on the point of shoulder, that an individual falls directly on the point of shoulder, then direct trauma due to road traffic accident, then indirect trauma due to fall on outstretched hand. Now let's see the clinical feature. Clinical feature are pain, swelling, tenting of skin, bump at the site of injury. Investigation: X-ray should be done in anterior posterior view and bilateral panoramic view. For treatment of both undisplaced as well as displaced fracture, let's first see of undisplaced fracture, that too conservative management. Conservative management consists of immobilization phase, which can be done through triangular sling or figure of 8 bandage. If we are going on with the triangular sling, we have to keep the limb in immobilization phase for 2 to 3 weeks, and if you are using figure of 8 bandage, then immobilization phase will be from 3 to 4 weeks. Now let's see for the displaced fracture. For displaced fracture, we have to go with the surgical management, either ORIF or either close reduction. ORIF means open reduction and internal fixation, which is done by plates and screws, and close reduction external fixation is done by K-wires. The fracture mostly clinically unite in 3 weeks, after which sling can be discarded and shoulder be mobilized. Now let's see the complication. Complication can happen both early as well as late. In early, usually we can see nerve and vessel injury, and in late, usually stiffness, malunion and non-union can be seen. Now let's move on with the physiotherapy management. The rehabilitation goal will be pain relief to improve and restore the function of shoulder, its range of motion, activity of daily living and sports activities, and to restore normal muscle strength. Now for the conservative treatment, the immobilization phase, in first week, treatment by sling or figure of 8 bandage should be done. Shoulder is held in abduction, internal rotation. Now do remember this, guys. Shoulder should be held in abduction and internal rotation, and elbow in 90-degree of flexion to avoid any gravitational force exerting any pull in the shoulder girdle and the shoulder joint complex. There should be no range of motions, no muscle strengthening. Now end of second week, all active range of motion should be there, which is outside of the POP cast. Then gentle pendulum exercise of shoulder as pain permits. Isometric exercise of deltoid and elbow. Now in mobilization phase, at the end of 4 weeks, gradual mobilization of shoulder. By 6 weeks, gentle active range of motion, abduction restricted to 80-degree, pendulum exercise with gravity eliminated, isometric of elbow, rotator cuff and deltoid muscle. No weight bearing should be done, but patient can use for self-care. Now in 6 to 8 weeks, full active range of motion, and that too in all planes. Resistive exercise to shoulder girdle muscle and gradual weight bearing should be begun. In 8 to 12 weeks, full active range of motion, and all these exercise is prescribed, that is abduction, isometric, isotonic and resistive exercise. Then full weight bearing should be done and normal use of affected side. Now in the case of surgical treatment, the first week stability depends on fracture fixation, whether it is done ORIF or close reduction. In ORIF, mobilization should start by 8 to 10 days. Then active range of motion of all the joints outside of the cast, isometric of elbow, suture is removed after second week, splint discarded after 4 weeks. After that, same as conservative approach. As you can see over here also I have mentioned, rest the management is same as for conservative approach in the surgical management after the 4 week, which we have seen over here. So that's it for this video. I hope you have learned something new, and that too in a simplified manner. I will see you in my next video. Till then, see you. Bye bye.